Today we're going to look at how to fill out a TAR form for California Medi-Cal patients. This is a treatment authorization request form. The first thing you're going to look at is, and this one says San Mateo, but it could be from any city or county. The type of service requested, you're going to check the box marked drug. Other would be something that's not a drug, like say durable medical equipment. They need, something like a walker or something like that. Where it says request is retroactive, if the patient has already paid for the medication and you're trying to get Medi-Cal to pay for it, you would click yes. Otherwise, if they haven't paid for it yet and they don't have the medication yet, you're going to check no. The telephone number is going to be the phone number of the provider, which in this case would be the pharmacy. So here, let's see, I want text. You're going to put pharmacy phone number. So let's say we're in the 909 area code. The provider fax number is where they're going to fax the yes or no or it could be a deferral that they fax. So this could be the pharmacy fax number. The NPI number is the National Provider Identification Number, and it usually starts with a PHY and about 5 digits. The provider name and address is going to be the pharmacy itself. So the name of the pharmacy, the address, whatever that address is. I don't remember the school address. Now up in this corner here, it says the patient's authorized representative, if any, enter name and address. So let's say the patient is in a boarding care or they're unable to come to the pharmacy and they have somebody who takes care of things for them. In that case, you would put the name of that person, it could be a caregiver, and what their address is. We don't normally have to use that. So the name and address of the patient, the last name of the patient, the first name of the patient, and I don't remember what the exact one on your sheet is, but we're going to go with Mary Smith, say. Now we need her address. Use the one that's on your assignment. Then get the Medi-Cal, the member identification number from her Medi-Cal card, and it's going to be 14 digits or so, however, whatever that number is. And I don't remember exactly what it is on that one. The sex should be either male or female, but sometimes there are non-binary people, so you'll have to find out how your specific area wants you to do that one. And then the age at the time you're preparing this, I don't remember how old the patient is, and then the date of birth. Then you want the patient phone number down here. The ICD-9 code is the International Classification of Diseases, and it'll have some numbers on it. If you don't have the ICD-9 code, you can look it up, or you don't have to put anything there for this assignment. We would get that from the doctor's office anyway. Now, the patient status is basically, where is the patient right now? Are they home? Or are they at a board and care facility, which is where they would be if they're unable to take care of themselves as far as cooking and shopping and all of that. An acute hospital is if they're in an inpatient in a hospital right now. SNF, ICF is a skilled nursing facility or a intensive care facility. And those are for patients who basically can't do anything for themselves. Board and care, a lot of times they can leave and go shopping and come back, and they're just given meals and things. But a skilled nursing facility is where they might need IVs or someone to take care of them physically. So in this case, we're going to say our patient still lives at home. So I want a check mark there. Okay. SMMC account number, SMMC type of service, and SMMC MR number. We're not going to worry about that right now. The diagnosis description is, in this case, it's going to be gastroesophageal reflux disease, which is what happens when someone has heartburn so severe that the acid splashes up in their throat and causes them to have some erosion of the esophagus. And that can actually turn into something like cancer, or it can cause them to lose their voice box, and it can be very serious. The medical justification is where we would put previous medications taken, like the medications tried and failed. So you're going to put what the patient has taken. And I'm trying to remember what it was exactly. I believe it was Pepsid. And doesn't work for long, and I don't remember what the problem was with the Pepsid. Are they allergic to it or something? I don't know. Don't remember on your assignment sheet. And also you guys need to read it from there and put it yourself. The other thing was calcium, like Tums, right? And that also doesn't work for long or doesn't work well. And then farther down from there, we're going to put that they were diagnosed and the testing that they did, whatever that testing was, put that test in there. And then the gastroesophageal reflux disease, and then MD wants patient to continue the Prilosec, I believe it was Prilosec. And for whatever reason, it works better than the above drugs, whatever it is. Okay, this over here, this is where you're going to get back either approved as requested or denied or deferred. Deferred means they want more information, so they're not going to make up their mind right now, and they'll ask you why, and you'll have down here to enter the comments. Approved as modified means that they're only going to allow it for a certain length of time, or they'll only allow it, you know, somewhat similar, but not the exact thing that you're looking for. And then here they're going to put authorized, yes or no, and the approved units, or how many times they can refill it. So for that, you're going to put Prilosec, and you're going to put, you can do the pharmacy notation, 1 capsule by mouth every day. And if this is too long to write, you can take a couple of lines to do this, okay? Units of service are how many times you want this refilled. Now, TAR can be good for up to a year. So if this is a medication that the pharmacist thinks that the doctor is going to want the patient to have every month, go ahead and ask for 12 units of service. And then the NDC number is the number on the bottle, and you can look up the NDC number for Prilosec or the generic Prilosec. And they want it in 5-digit, then 4-digit, then 2-digit format. So let's say that the TAR number is 78-4212-6. You're going to want to change this to 5-digit, 4-digit, 2-digit. So how do you do that? Let's add some leading zeros. 00078. And then 4212 is already 4 digits, but let's take out the dash. And 6 is only 1 digit, so we want to add a leading digit there. So these are the parts of this form, 78, 4212, 06. Those are the parts of the NDC number, but you want it to be in 5 digits, then 4 digits, and then 2 digits. And the quantity, if they were taking this drug twice a day, you'd want 60 for a 1 month supply. But since they're taking it only once a day, you're going to ask for 30. And then the next part is the charges. How much will this normally cost the patient if they were paying cash? So this could be as high as, you know, $99.47. I don't know exactly how much this costs. In your assignment, go ahead and make that up, because we have no way of, I guess you could call a pharmacy and ask what their price is for generic Prilosec for 30 tablets. And oh, I forgot over here, you want the milligrams. And I believe it might be 40 milligrams. Look on your assignment and see for sure what it is. Okay, so then it says here, the authorization is valid for services provided from this date to that date. And it's inclusive, which means if it ends on December 31st, you have to get that last refill in by December 31st or they won't pay for it. They'll give you a control number. The office here is either going to be 40 or 80, depending on what county you're in, because they have different offices. Then they may have a different number by now, but it's going to be very similar. Then they'll give you a long number. That's the TAR approval number. And this last digit is usually a 0. Okay, so that's what it's going to look like when you get it back. But this is filled out by the Medi-Cal authorization people. So we don't fill anything out there. Here you want the signature of the physician or the provider. So you can sign your name to this TAR form. Let's say that it's being filled out by Jonathan Suarez. And then the title, we can put CPHT if you're a certified pharmacy technician, and the date that you're filling the form out. So we could put 5/1/2021, 5, not 15. There's no 15th month. Okay, so that's how you would fill that out. Now, if you're filling this out and you have all this information, you see why there's pieces on this form that you don't need to fill out, and it can be really confusing for someone trying to fill this out for the first time. So since this is the most comprehensive form that I've seen for most insurance plans, if you can fill this out, then you'll be able to fill out other forms from other insurance companies. So the CalOptima form, I believe one of those requires the doctor's name and address and phone number, maybe the license number, and that is in your assignment, so you'll be able to fill all those fields in. Everything else is pretty much self-explanatory on other forms. So if you can fill out this TAR form, you should be able to fill out a Blue Cross form, a CalOptima form, RX America, Pacific Care, all the other forms that are out there. You should be able to fill them out with no problem, because they're all just a more simpler type of this form, okay? So that's how you fill out the TAR form. It gets faxed to the Medi-Cal office, and you usually hear back within a day or two. Sometimes the pharmacist will want to loan a few tablets to the patient if they're pretty sure it'll be approved. Otherwise, the patient will continue with their previous meds, which, you know, in this case probably was the Pepcid or the Tums, until it gets okayed, because these drugs can be very expensive, which is why you're filling out a form to try and get it covered by the insurance company. These are for drugs that are not normally covered. So you're asking them to make an exception in this case. Okay, and that's how you fill out the TAR form.